Hello, everyone. Thank you for tuning in for the real deal with StudentProCONNECT. StudentProCONNECT is a social networking site where students, industry professionals, and entrepreneurs can connect. If you're a student or someone looking to change your career or just get your business up and running, this is where you can find people that are going through the same things that you are going through right now. Every show, we feature a guest who's just sharing their story, sharing their journey with us, and just giving us insight, about based on their experience and everything that they've been through. If you haven't done so already, please go to our website www.studentproconnect and sign up, or you can download our app, which is available in Google Play or the App Store. So now, without further ado, I'm so excited for our guest. She is a doctor of nursing practice with a specialization in midwifery. Please welcome Dr. Gael Duvivier.
Hello. How are you?
Good. Thank you for joining us tonight,
Thank
Gael.
you for having me.
Yes.
Pleasure.
Say that again.
It's a pleasure to have me on the show with you.
Oh, well, we're so happy. Now, midwifery, we don't hear a lot about midwives, right? I feel like they're kind of behind the scenes. They don't really get they're not at the forefront. So we don't know. I mean, I have to say, I don't know a lot about the field. So I guess my first question would be, how did you get interested in it?
So I always wanted to be in like a field where I can deliver babies and take care of pregnant women, which essentially would have been an OBGYN, right?
Yeah.
And that's since I was young. But when I went to nursing school, I decided to just major in nursing just because I was like, let me be on the safe side in case I don't want to go to medical school. What am I going to do with myself, right? So I went to nursing school, and in my last semester of nursing school, I was taking OB, maternity rotations, and I saw a C-section, and it didn't go too well. So after looking at the C-section, I was like, there's absolutely no way that I am going to become an OBGYN because I can't do this. So that I have to find an alternative where I can still take care of pregnant women and deliver babies. And when I looked it up, I saw, hey, there are nurse midwives. It's not really something people talk about. It's up and coming. More and more people are becoming midwives, but that's how I began my journey as a nurse midwife.
Wow, that's amazing. So you saw what happened and it just scared you. You're like, I'm
It
not doing
scared
this.
me. I had to go home early. It was, it was a sight. It was not a pretty sight.
You were like, I just can't. You couldn't see yourself doing that or being in
No.
that position.
I really couldn't. I really couldn't.
Wow.
How am I going to cut open a patient? And that
Yeah.
it was fearful for me.
So does that mean, I guess this is a question, I guess we'll probably get to it, but does that mean, so in midwifery, you don't have to do any surgeries or anything like that?
You don't have to do any surgery. So you deliver babies, you can admit patients, everything that an OBGYN can do, birth control prescriptions, abortions, everything that an OBGYN can do, you can do. The only thing is you're not that caregiver that's going to do the surgery. You can be first assist in a surgery. So you can be the assistant to the OBGYN and help with the procedure, but you're not the main person during the procedure.
Got it. All right. So tell us, what was your, I guess, educational journey? First of all, what did you major in college? And then did you go on to do your master's? So tell us, kind of walk us through it.
All right. So I started majoring in nursing. I did an associate's in nursing, but the school that I was going to was a 4-year school, but you had to do the associates before the bachelor's. There wasn't a straight bachelor's program. So I did an associate's in nursing, and then after that, I did my bachelor's. So it took about 4.5 years. And from there, I started to work as a home health nurse and then med-surg. And during my med-surg rotation, like working as a med-surg nurse, I applied for a master's program in nurse midwifery. So that took a little over 2 years. And then from there, I went and got a postgraduate certificate in women's health nurse practitioner, because it's like essentially the same thing, except as a women's health NP, you get more GYN hours. So I went and did extra GYN hours so I can be able to sit for both boards and also have both licenses. And then from there, I decided to continue because I was in a dual master's doctorate program and continue and get my doctorate. So
Wow. So your doctorate is in nursing practice,
Yes.
the official. So with the doctor of nursing practice, you can go into essentially many different fields, right?
Yes, but the focus was sort of midwifery. You have to choose whatever you have your master's in, but it's a general doctorate. So you can go in any nursing field because
Mhm.
what the doctor of nursing practice does is teach you about quality improvement. So whereas a PhD nurse, there's essentially the one starting the research, you're
Mhm.
improving quality. You're as a doctor and nurse, you're actually improving quality care. So the research has already been done, but you're actually showing how can I improve it? What interventions can I use to improve care?
Got it. Got it. Okay. So right now, I guess you're working officially as a midwife. That's your official title.
My official title is a midwife.
Okay.
I'm actually starting a new job as a midwife in a few weeks, but I
Oh,
am in academia. So I
okay.
am a professor. I teach like health informatics, health policy, and maternity nursing.
Wow. So first of all, congratulations on the new job.
Thank
First
you.
and
Thank you.
foremost. And I think that's interesting. So you're in academia. So
Yes.
is that something that you always knew you wanted to get into, or did it just kind of come about?
In nursing school, I kind of wanted to because in nursing school, I kind of found it like, oh my God, sometimes every student thought the professor was out to get them.
Mhm.
And I had professors that were so wonderful that I was like, I want to be one of those professors where I can educate and have the students feel comfortable being educated and not feel like it's a game. I want them to know it's real and they can do it. So I decided, hey, I can do this part-time. But doing the doctorate, I really fell in love with it. So I
Mhm.
decided to pursue it as a full-time career.
That's awesome. Now, is that something that you want to, I guess, no matter what, you're going to continue being, in academia?
Yes,
Okay.
I
So that's
am.
for
I
the long
love
term.
it
That's
for
for
a
the
long
long
time.
term. Now, for the midwife position, have you worked as a midwife before?
I have never worked as a midwife. I because the reason I didn't was because I went to finish the postgraduate certificate.
Mhm.
So it would be too much juggling a job, and also you
Mhm.
can't work where you're doing your clinical hours.
Okay.
And the where I was doing my clinical hours, they wanted me to work there. So I had
Mhm.
to finish that and then continue.
So I guess my question, the biggest question here would be, what are your expectations going into the job? Like, what do you envision your day to day to look like?
So my day to day, since I'm used to the practice, I can sort of tell you, it's basically seeing a lot of the patients come in for birth control.
Mm-hmm.
That's one of our big things. They come in for IUDs, for just regular birth control pills. Some of them just come in because they're pregnant, right? So I'm not going to deliver babies. I'm not full scope. Full scope meaning full scope midwives or midwives that actually see the patient in the clinic and deliver them outside.
Okay.
My partner, she is going to deliver them outside. I just want to stay part-time in the clinic because when you're full scope, you're kind of like on call all the time. So
Okay.
I'm not going to have that in my schedule, but I will be seeing the pregnant patients, making sure they get all their ultrasounds done, all the necessary blood work, seeing patients that come for even um, prenatal counseling, right?
Yeah.
Patients that want to get pregnant, preconception counseling, and they're unable to. So educating them on, the what they need to do, referring them out to other physicians, because a lot of you really have to work collaboratively with other people, seeing patients that come in just for pap smears, or
Yes.
even if they had like an abnormal pap smear, basically performing biopsies on these patients, and if they need to go out for extra care, then referring them out for that.
Okay. So I guess just clarify a little bit for us. When I think of a midwife and I think of an OBGYN, I feel like there's a lot of crossover. So what would you say is the biggest distinction? Like why would someone choose a midwife over an OBGYN and vice versa? Or what's the difference?
So what a lot of people say the difference is that it's lower intervention,
Mhm.
um, meaning a lot of people feel like certain OBGYNs, and I don't want to say all because it's not true. It might not even be a majority of them. They feel like there are too many interventions, such as just saying, "Oh, you need a repeat C-section." So they want the care to just be more personal, right? A lot of times they say midwives are there side by side, and which is true. They stay a lot with the patients in the room, where OBs have so many patients on the unit, they can't provide that one-on-one care. It's not that the midwife doesn't have so many patients. It's just like it's more spread out. They're more smaller practices. It's not as big, right? Unless they work for a big practice, which sometimes big practices have more than 2 people in the hospital at the same time when it's time for delivery. So they say it's more low intervention. A lot of people want natural births, and they feel like midwives cater to that. Like we're more laid back about that and not pushing epidurals. But a midwife can take care of a patient with an epidural because majority of patients do get it, right? But the midwives kind of like they help assist them. They help cope, pain coping and things like that. So that's why a lot of patients lean towards midwife for home births, especially. Home births is one of the big things coming out now. Home births were more popular in the old days. We didn't have women going into the hospital all the time. Even if you hear like in other countries, people still, perform home births quite frequently. But in the US, that's not a very common thing. It's coming back though. With COVID, especially, a lot of people went to birthing centers.
That's what I was going to say. Yeah, COVID. Yes, definitely changing the game, probably.
Yeah, it did. So a
Yeah.
lot of women went back. And so they have birthing centers. So there are birthing centers that are outside of hospitals, and some hospitals actually have birthing centers, which when they have it in the hospital, it may not be on the same unit as the OB floor, but in case of an emergency, it's easier to get into the unit than coming from the outside, waiting for an ambulance to come in, all those things.
Wow. So do you foresee that it's going to remain popular, or you think it's going to keep growing?
I think it's going to keep growing.
Yeah.
It's definitely going to keep growing.
Okay. Now, how does someone find a midwife position? Where do they start looking? How do they apply? Where do you look?
So they have midwives that are hired by hospitals, right? So you can go on a hospital website and you're able to look it up. You'll find a midwife job. They'll tell you, hey, you'll be doing certain clinic days and then you'll be in the hospital certain days. Then you also have private practices that hire midwives, right? So these private practices can just be midwife practices, or it can be practices that also have physicians. And then like in a state like New York, if you want, you can open a clinic. You're not limited to working with anybody. It's like as a nurse practitioner in the state of New York, you have to work 3,600 collaborative hours before you can open your own practice. But as a midwife, you don't need that. You're able to open your own practice in New York, and it's not an issue. You can do everything. You don't need to collaborate with anybody, which is good. Obviously, you want to have people that you can refer your patients out to, because there are instances where you're limited as what you can do for the patient. But you can, in New York, you can definitely open your own practice. So you can work in your own practice, you can work in private practice, or you can work for a hospital facility. There are also a lot of community practices. They're not private. They serve the underserved population, minorities, essentially. So that's another big thing.
Wow. So there seems like there's a lot of room for growth in this
A
field,
lot. There
right?
is.
It seems like you can do so many different things.
Yes, you can, but not many people know that. Some people don't even think you have to go to school to become a midwife. They're like, yeah, but you have to.
But you do have to go to school.
But you know why? Because in the old days, a midwife didn't have to. They had different kind of midwives in the old days. But you do have to in America. Right?
Yes, and I think that leads right into what are the biggest misconceptions. So first and foremost, you don't need to go to school. And another one, I think, and you kind of touched on it a little bit, I kind of feel like I've heard that midwives are kind of like natural. They're all natural.
Yes, exactly. So they believe that you can't deliver in hospital settings, right? Or you can't prescribe medication. Or you can't collaborate with an OBGYN, or even be in the operating room, but you can actually first assist. So those are some of the misconceptions. I find that a lot of people just think like midwives live in La La Land. But
we're like hippies.
We live
like hippies, and they're against medicine. Like everything is
but it's
natural.
Not true. It's not true. We support natural.
Yeah.
which is a very big difference. We support natural. You want to support natural. You want to give the person their option and choices.
Yeah.
Obviously, sometimes things don't go as planned, right?
Mhm.
Um, but you're an advocate for your patient, and you let your patient know, hey, things may not always go as planned, but I'll support you and I'll help you get through whatever it is that you're going through. You may
Mhm.
come in and say, hey, I want natural. And believe me, natural is not going to work. You may come in and say, I want to go into labor on my own, but you never go into labor. So what's going to happen? You're going to get induced, right? So you
Exactly.
can never plan, right?
Yeah.
Yes, in the old days, most people went in on their own, but it's not the same way. So we
No.
we provide care for everyone. We're
Exactly.
open.
Yeah. And I guess it's kind of like you're going to support whatever the person chooses at the end of the day. It's just, I guess it's more nurturing. It's more
Yes,
of a nurturing and kind of just educating kind of system or approach.
exactly.
Okay.
And I think that's what it is too.
Yeah.
Exactly.
Yeah. So I guess what qualities would you say would someone need who wants to go into, like, for instance, I like the story that you gave in the beginning when you went into that, C-section and it didn't go well, you knew it wasn't for you, right? So I guess what qualities would you say, someone should have if they want to be a midwife?
I think the two biggest ones are patience and communication.
Yeah.
Why do I say both? They both go hand in hand, right?
Mm-hmm.
When you're dealing with patients,
Mm-hmm.
they kind of need you to support them.
Mm-hmm.
And in order to support them, you have to have open communication with them. You can't be behind the bush with patients. You have to let them know exactly what it is. Patients that are pregnant, they're nervous. These women are very, very, very nervous. So
Mm-hmm.
you have to explain to them, hey, this is why I'm doing this. This is the reason for this. Like if you're doing a blood work, I'm doing this blood work for this. This is the results of your ultrasound. Communicating with them, because
Mm-hmm.
a lot of time when you don't communicate with them, you get them to become nervous. They lose trust in you.
Yeah.
They become afraid in the whole birthing process. When it's time to deliver, they don't know what to do. They start to panic. No one is ever going to remember exactly what to do, right?
Yeah.
But if you communicate with them along the way, they will be more open to talking to you and to taking direction. A lot
Mm-hmm.
of it is direction. I mean,
Yeah.
when you're delivering someone, they're like, I'm in pain. But if you never told them they're going to be in pain, that becomes unexpected to them, right?
Yes.
They're,
Yes.
they're like, I didn't know this was going to happen. No, you have to be open with them. You let them know. So patience and communication is a very big thing. And why I say patience too, because pregnant women, they have a lot of questions.
Yes.
But you should answer their questions, right? Because it's new. It's very new. It's like after they have the baby, they still have more
Of
questions.
course.
Oh, another thing I didn't point out, we get to take
Yes.
care of babies for the first 30 days.
Wow. That's what I
So
was going to say. So even
to the
after birth,
circumcision, yes.
hey,
Yes.
wow. That's amazing. So I think, and another thing too, I get when you say patience and communication, it's all about earning the patient's trust. Like,
Yes.
so you need that person to trust you. Um,
Yes. I mean,
and without, yeah.
who
Mhm.
would want somebody to deliver their baby and they don't trust the person?
Exactly. Exactly.
You
Exactly.
know?
Yeah, so you need to have that personality where you can, first of all, be able to be able to take all those questions constantly coming
Yes.
at you, and then also be able to verbalize and kind of again be soothing in the as well as communicating to them.
Yes.
Yeah. So what would you say is the most challenging thing as a midwife?
Um, the most
Is it the
challenging.
questions?
I mean, that was a hard one, right? But
Yeah.
I think one of the most challenging things, and I haven't experienced this, but seen this working as a labor and delivery nurse,
Mm-hmm.
is the communication sometimes amongst the staff and the midwives. Sometimes some midwives want to do different things and physicians don't agree with it. So I think communication again plays a role in that. So being able to work with a team that trusts you, or building that trust with the team, because a lot of time they don't know you and you're coming to this facility and they don't know you. So you have to kind of like show, hey, this is who I am. This is what I'm going to do. This is how I'm going to do it. I'm here to keep patients safe. I'm not some person just from the outside, just that doesn't have a degree, that doesn't know what they're doing. Because again, like you said, a lot of people don't know about midwives, and they have some places have really bad connotations about midwives. So
Mhm.
getting that out of the way in the beginning is one of the biggest things.
That's really interesting. So it's, if anything, it's an internal challenge more than even dealing with the patient. It's also dealing internally of trying to not just gain the trust of the
Okay.
patient, but also making sure that people know that you are an expert. Like they
Yes.
don't undermine you.
Yes.
So that's interesting. That's really interesting.
Yeah.
Now, how do you, I guess you have to just put your foot down. How do you deal with that?
You have to put your foot down, and you also have to show that you're able to provide that care. If
Yeah.
you come in there and you look like you don't know what you're doing, how do you want people to trust you? How do you want to gain trust? So
Mhm.
you have to show your confidence, and not just show it by acting confident, but doing the right things, right?
Mhm.
um if I'm talking to you, right,
Mhm.
by the way I tell you certain things, you can tell, hey, she knows what she's talking about. If you're an expert in the field and you hear what I'm saying, you're going to be able to know if what I'm saying is correct, if it's incorrect, if
Yeah.
I'm doing something safe. Sometimes they say certain midwives do unsafe things, and it's not only midwives that do it, but because they have that stigma already to them, people pay close attention to it.
Yes.
So
Yes.
you have to be the one to promote yourself,
Yeah.
to show like who you are and what you're doing, and that you're providing the care that is needed.
Definitely. Yeah, definitely. You have to show that you know your stuff and be
Yes.
confident about it. Okay.
It's like going to academia. You go into and you're talking to your student and you're telling them all the wrong things that in the
Yeah.
book is saying something totally different.
Yes.
Your
Yes.
students are looking at you like,
Exactly. And I was going to say that's really great that you're in academia because here you are the expert. So
yes,
if anything, that's also helping you as well. Like
yes.
you're,
That's up to date. And that's the thing.
yes,
In the healthcare field, you really need to keep up to date. Things
that,
change day by day.
yes,
You
yes.
have to keep up to date.
So that's a great mixture having the two together because then that ensures that you're always up to date with everything. So you're able to actually go in the classroom, know what's going on, and then also be able to execute it at the same time
Yes.
as the midwife. So that's a great, mesh of the two. So that's
Yes.
cool. Cool. Now, did you have any mentors along the way?
So along the way, one of my biggest mentors was actually my preceptor. She was a labor and delivery nurse as well. So being with her, she kind of understood working as a labor and delivery nurse, and that kind of helped me break it because I was a little nervous. You're
Mm,
coming from just being a nurse where you're taking orders, right? The
mm,
doctor's telling you, hey, this is what you're going to give the patient, but now you're the one giving orders,
mm,
right?
mm,
You're learning how to prescribe medications. You're learning what tests are necessary. You're learning to think, hey, the patient is showing up with this symptom. What do I do?
mhm,
So she showed me kind of how to get around that. And another mentor I had was my director of nursing when I worked on labor and delivery.
mhm,
She knows her stuff. Like there's not you can tell her something right now, she's gonna answer it. If you tell her, can I get this done? She's like, okay, give me a few minutes. She remembers everything you're telling her. And that kind of showed me, hey, I need to be one of those people, proactive, being proactive.
mm.
She taught me the importance of being proactive.
So these were mentors that you found in
In
your
the
in your
along the yeah.
in your school. Okay, so you were fortunate enough to find
In
people
school and at work.
and at work. And you used the term. You said preceptor. Was that the
Yes.
term? So what is a preceptor?
So your preceptor is, so when you go into clinicals to do clinicals, right? When you're in school and you're learning to actually do the clinical aspect of what you learned in the textbook, you
Mhm,
have preceptors that you follow along the way, and they kind of show you, hey, this is how you do a pap smear.
mhm,
They're your guide, right? They're putting the practicum out there for you. So they're your guide. They show you how to do pap smears, why you order this. This is how you order. This is how you chart the important aspects of your clinical practice. So
mhm.
I did an online program. So
Okay.
doing it online, all my didactic work was online, but the actual hands-on, I have to go somewhere. So that was my preceptor. She did that part. And then the school sent out somebody to come evaluate me.
Got it. Got it. Got it. Okay. Now, would you have done anything differently? Like if you're looking back on your journey, of where basically where you are today, would you have done anything differently?
In all honesty, no, I wouldn't change a thing. I'm very passionate about what I do, and that leaves me content. Women's health and academia are my happy place,
Mhm,
as one allows me to provide quality care and the other allows me to educate our future nurses on providing the utmost care. So I wouldn't do anything differently. I don't see myself being like an FNP, a family nurse practitioner. I can do it. I know I can go to school and I'll pass school and I can do it, but that's not what I'm passionate about.
Got
What
it.
I'm passionate about is women's health. We have a big maternal health crisis out there.
Mhm,
And I feel like, especially in minorities, and I
mhm,
feel like I'm that voice to help change that. So
mhm.
I'm very, very happy with the steps that I took,
Yeah.
and I wouldn't change anything.
So I guess that kind of goes right into, I guess, what's the most rewarding thing for you? And I think you touched on it already. Um,
Yes.
yeah,
So the
yeah,
most rewarding thing for me is seeing that my patients are satisfied with the care given, and leaving a smile on their face.
yes.
It's like very gratifying to know that I can make a difference in improving, the maternal child health crisis. So
Mhm. Now, I know we kind of touched on it a little bit with COVID, and we're saying how the demand for midwives is actually going up because of COVID. Uh,
mhm.
do you foresee any other changes? I mean, aside from demand going up, do you think it's going to be harder to become a midwife? Do you think it's going to get easier? Do you think it's going to get harder to get a midwife's job? Like, what do you foresee based on, I mean, you've actually just been through it, with
I don't
getting
think
a
it's going to be
job.
harder. I think there may be more practices leaning towards midwives. If you're an OBGYN, right, and you see that you have your own practice and you see a lot of people want midwives, what are you going to do?
Yeah.
You're going to hire a midwife. So I think that they might go towards that direction. It doesn't mean that just because you're seeing the midwife that she'll deliver you, because it's whoever's on call, if you're, with a private practice or wherever you're working. But at least more patients will come to your clinic to come see you.
Mhm.
Um,
Mhm.
I think there's going to be a growth, definitely a growth. Right now, you can see even with just nurses in general, there's probably like a
Mhm.
shortage with
Yes.
COVID, with
Yeah.
those that were hit with COVID, or just in general, a lot of hospitals, they're short staffed. So I think there will definitely be a growth. And a lot of people are learning about it now. So I
Mhm.
mean, my students that I take to maternity clinicals, they're like, oh my God, professor, I think I want to be a midwife. Like they weren't interested in until they saw the deliveries, and they're like, "Oh, this is wonderful." I'm like, "Yes, it's there.
Yeah,
You can do it. Do more. Go for more."
yeah,
I mean, it never hurts to get more educated.
for sure.
Um, Even in nursing, like doctorate nurses, we're only 1%.
That's what I
So
was gonna ask you. I was gonna say there's probably not a lot.
no, not a lot.
Yeah, so there's definitely room there. There's
There's
a lot
room for
of room for
growth.
growth. So if there's somebody out there thinking about doing it, you would say go for it.
Go for it,
Go for it.
definitely.
And
The only thing I'll say is if you want to be full scope,
yeah,
right, deliver babies,
yeah.
you have to really be dedicated to that, because depending where you work, you might be on call and you have to leave your. I remember when I was in school, I mean, my preceptor would call me, "Hey, our patient is in labor." I had
Mhm.
to get up, even if it's 3 in the morning. I got to get out my bed and make it to the hospital. So you have to be dedicated to that.
Oh,
But
gotcha.
it's rewarding. You're bringing a life into this world. So there's nothing more, for me at least,
Yeah.
more interesting and more wonderful than bringing a life into this
Sure,
world.
for sure. Now, what piece of advice would you leave someone with who's thinking about it and let's say haven't hasn't even started school yet, or maybe they're in school? What's the best piece of advice you could give them at this point?
I would tell them how rewarding of a career midwifery is, as you get to take care of women in all stages of life, from adolescence and to postmenopause. Although the lifestyle can be busy and challenging, don't let that determine your final choice.
Yeah.
Midwives can work in various settings and help improve the care of all women.
Yeah, that's awesome. You have given us so much great insight. I learned a lot in just a short amount of time. I didn't know about midwives at all, and I'm sure everybody listening probably think the same thing. So thank you so much, Dr. Gael de Vivier, for giving us, some insight and just kind of giving us a little sneak peek into your journey. So thank you so much for that.
Thank you for having me. It was such a pleasure talking to you.
Thank you. Thank you. So, for those of you listening, if you haven't done so already, again, please register on studentproconnect.com, or you can download the app. It's the same thing as the website, probably easier because we're all on our phones these days. So, it's available on Google Play and the App Store. Please stay tuned for our new shows that are going to be uploaded every other week. So, thank you for listening and have a great rest of the day.
All right.